Namaskar, Adab, Sat Shri Akal, a very warm welcome. Welcome back once again. I would say थोड़ी देर पहले हम मिले थे and we talked about some of the good things happening in and around Mumbai, and now we are really back to some important topic which is really impacting India, and COVID ki situation uh, is getting a little better, I would say, in some cities, but it's still very bad. It's still very sad to see people not able to find hospital beds. They're not able to find oxygen cylinders, and the cost of getting those injections and vaccines and everything is spiking. बहुत ज़्यादा डिफिकल्टीज हो रही हैं, कुछ लोगों को तो बेसिक इम्यूनिटीज भी नहीं मिल रही हैं, and so I thought this would be a great session because we've been talking to a lot of doctors. Last night also in the session we had a couple of doctors speak about certain things that we should be doing, should be uh, not doing, and some of the precautionary measures that we can take, especially like wearing a mask and whatnot. So I thought it makes sense to have this dedicated session where I am blessed. I am really always humbled to have certain people who are always available to do something for the community, and for that, I'm really grateful to each one of you. Today, this particular session, we will have Dr. Kala, who is a practicing doctor. Uh, she will introduce herself a little bit, that what she does and who she is, and the only thing that I want to tell about her is, yes, she is definitely following this channel. She's following, what we do here, but more importantly, she wants to do this for the people, for the community, so that people are aware. People are made aware of, the seriousness of this problem right now. This is a pandemic. This is worse than a pandemic right now. But at the same time, there are certain things that can be done. लास्ट नाइट ऑल्सो उन्होंने थोड़ी सी बातें शेयर की थी, हमारे साथ डिटेल शेयर की थी, एंड वी वर हैप्पी that there is someone who is ready to kind of spend their time and educate and kind of tell us what needs to be done and what cannot or should not be done. So without wasting any more time, this session is just going to be about Dr. Kala explaining everything in detail. She's going to educate us, guide us. So please keep your questions, park your questions for some time, and if time permits, we will definitely take you in as well into the stream so that you can ask your specific questions. Is session mein I would not be able to kind of help you directly right now getting some kind of beds or oxygen cylinders or injections, but at the same time we will still continue to do offline that kind of conversation. And the last thing, which a lot of you have pinged me, a lot of questions have been asked around Ramanji. uh, Ramanji's mother is okay. She's stable. She is doing okay right now. Please continue to send prayers to the family. It's a fight that she's definitely, this battle she will definitely win. So don't worry about Ramanji and Ramanji's mother, but as we can all understand, the situation is really bad. So let's all send positive vibes and prayers, not only to Ramanji, but everyone who is in India right now and going through this hell. All right, so let me just, without wasting more time, let me take Dr. Kala. Welcome and namaste. Good morning.
नमस्ते वरुण जी, मेरी तरफ से सभी को नमस्ते। मेरी हिंदी इतनी ज़्यादा अच्छी नहीं है, लेकिन मैं कोशिश ज़रूर करूँगी कि मैं हिंदी में बोल पाऊँ ताकि ज़्यादातर लोग समझ सकें द ग्रेविटी ऑफ द सिचुएशन। मैं बीच बीच में इंग्लिश में भी बोलूँगी। मैं ज़्यादातर आई फील कंफर्टेबल स्पीकिंग इन इंग्लिश, लेकिन मैं ज़रूर कोशिश कर पाऊँगी कि हिंदी में बात कर पाऊँ और सेंड यू द इन्फॉर्मेशन। थैंक यू वरुण जी, बहुत धन्यवाद। आपने ये मूवमेंट स्टार्ट किया। मेरा जस्ट अ लिटिल बिट अबाउट मी, मेरे को कुछ भी नहीं पता सुशांत के बारे में, ना अबाउट दिस मूवमेंट. I know there are so many heroes amongst us who are doing so much, and Sushant himself is the greatest icon of being sacrificial for the society, for humanity. इसमें कोई question ही नहीं है. So when people, I'm going to start off with this saying, if Sushant was alive, And if Sushant is in this situation, what would he do? What would he want you all to do? You know, he's a hero, he's the real hero, but I'm sure he's going to call each of you equally a hero for contributing to prevent the spread of this infection. And that's what I'm going to focus upon, to prevent the spread of this infection. एंड इसेंशली मैं ये बता रही थी, अगर सुशांत जी ज़िंदा होते या ज़िंदा है, बिकॉज़ मैं इतना बहुत सुनती हूँ, मेरे को पता नहीं क्या सच है, क्या सच नहीं है, लेकिन वो हमारे अंदर बिल्कुल ज़िंदा है, तो वो तो मैं हर किस आई मीन आई विल ट्रस्ट दैट, आई बिलीव दैट ही इज़ अलाइव, दैट्स वाई हम सब जुड़े हैं इस मूवमेंट में। तो मैं आप सभी को जो कोविड सच नहीं है मानते हैं, ज़रा आप एक बार ध्यान में रखिए, अगर सुशांत जी जिंदा होते तो अगर वो क्या करते होंगे अभी इस मोमेंट में, अगर देश ऐसा है, हाल ऐसा है, जो अपना लाइफ तक कुर्बान कर दी है फॉर ह्यूमैनिटी से, एक अपनी ह्यूमंस के लिए, मतलब आई डोंट नो व्हाट्स द वर्ड फॉर ह्यूमैनिटी, बट यू नो फॉर हमारे लिए, मतलब हमारी सबकी लाइफ्स के लिए किया है, नो ऑल द थिंग्स इज डन, and we are waiting for the people in the highest positions to give us the justice. We'll wait on that. I'm not divert on that. Essentially, मैं एक डॉक्टर हूँ, मैं इमरजेंसी फिजिशियन हूँ, एंड आई इन माय हर दिन का काम मैं जो करती हूँ, मैं इमरजेंसीज देखती हूँ, जो पेशेंट्स आते हैं लाइफ एंड डेथ के बीच में। बट आई एम नॉट एन एक्सपर्ट ऑन, आई हैव टू टेल यू, मैं कोरोना वायरस के एक्सपर्ट नहीं हूँ, but as a doctor I have basic information on how we can prevent and protect ourselves, protect our families, and prevent the spread. You know, that is very, very important and crucial. Hopefully I'm making sense to both the audience of English and also Hindi. तो मेरी कोशिश यही होगी कि हम क्या कर सकते हैं, यू नो, आप सभी लोग, ईच एंड एवरी वन ऑफ यू, हर कोई, हर किसी पर्सन है, हर ह्यूमन इज अ हीरो इन दिस वॉर। एंड मुझे बताना है आपको कि क्या चैलेंजेस है हमारे सामने फिलहाल, कि इट इज़ मेकिंग लाइफ सो डिफिकल्ट, कि ज़िंदगी इतनी मुश्किल हो गई है हम सभी को, हम इतने चारों तरफ हर किसी को वी आर सीइंग देम लाइक suffering because of the illness itself, and from the lack of beds, from the lack of oxygen, from the lack of information. I think a lot of things are going on. तो द प्रॉब्लम इज, ए वायरस जो है वो बहुत ही वेरी 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 टाइनी, वो आपको आँख दिखाई नहीं देगा, सो इट इज़ माइक्रोस्कोपिक, तो आपको स्पेशल इक्विपमेंट के नीचे ही वो मिलेगा, मतलब यू कैन नॉट सी इट विद योर आई, आपको आँख में दिखेगा नहीं, तो आपका शत्रु जो है आपके सामने है और आपको दिखाई नहीं दे रहा है। सो दैट इज़ द बिगेस्ट चैलेंज। ये हमारी बहुत बड़ी, आई डोंट नो, वरुण जी आप बोलिए, चैलेंज है कि हम
Right.
how to face your enemy when you can't see the enemy,
You know,
right?
I would suggest let's continue in English. Or jahan wherever I feel, I'll try to translate it. But let's
Okay.
continue in English.
Sure, thank you. So the biggest challenge for us, we don't see the enemy. We cannot see the enemy, and that's the reason why. रमन जी का मैसेज मैं भी देख पा रही हूँ, थैंक यू
Yes.
रमन जी, एंड थैंक यू फॉर ऑल दैट यू डू, एंड आई एम सो प्लीज टू हियर about your mother, that she's getting better. All our prayers are with her and everybody else as well. So yeah, so I'm going to talk about the challenges. Yeah. So because you can't see it, we are like reassured, like हाँ मुझे कुछ नहीं होगा. You're reassured because you can't see the enemy, but the virus is there everywhere. Like if somebody has just coughed and walked away, the virus can be floating in the air for some time, and then it can settle on all the surfaces. So things which you touch, there is virus. So that is the reason why that hand washing is so important. ठीक है, सो अभी जो हाल हो रहा है इंडिया में, जो वेरी वेरी डिसअपॉइंटिंग, आई मीन वेरी हार्ट ब्रेकिंग, आई डोंट नो डिसअपॉइंटिंग is the right word, but it is very heartbreaking to see what is happening. But what is happening right now is not because of what we done yesterday or what happened 1 week ago. It is almost like 2 weeks ago. Whatever has happened has caused these infections, and if we don't do anything about this now, things are going to get much more worse, because the virus, it is smart in the way that it's changing the way it is, like the mutations, you must have heard about it, and also the fact it multiplies in an exponential growth.
Right.
So मैं वो कोशिश करूँगी, I'll try and explain to you what that exponential growth is, like how you have to break the chain. So I'm going to ask each one of you to please be a hero and break that transmission of the infection, break that chain of spread of infection, so that we can save lives. Okay. So that's what I thought, those are the challenges. And why am I doing this? Because it is my call as a human being. I have no conflict of interest of promoting any treatments or doing anything. I don't want followers, anything. I just thought I have this information. I have to share it with people, because if we can save lives, what else more do you want in life, you know? So that is the greatest thing you do, is to help others and save them and save their lives. I'm sorry if my thoughts are being a bit disorganized. I wanted to do it in a different way, but I'm still going to go on and say what I want to say. So, thanks to Varunji for this opportunity, and I want to really thank Dr. Susie Wiles. She is from New Zealand. She's a microbiologist. She's the doctor who specializes in these microorganisms, these bugs which you cannot see with your eyes. She, along with a gentleman who is a cartoonist and a writer, Mr. Toby Morris, they have a set of illustrations which kind of explains in very simple terms for a common man to understand how it is being spread. I'm sorry, how it is being spread and how you can stop it from spreading as well. So I'm going to use three of their slides. I don't want to overwhelm with too much of information as well. So I want to talk about things we can do right now to prevent this from becoming worsened. Because the need of the hour right now, we are already struggling with no beds, no oxygen. Imagine if this is getting much more worse, what is going to happen? So we don't want to get there. I'm confident together we are in this and we will get through this. Stay positive, have positive vibes. That is very, very important. Don't get disappointed if you or any of your family are getting infected. I mean, we can talk about that in a little while. It is scary, really scary for everyone all around the world. But getting scared is not going to help us. We have to take action right now. So, this is what I wanted to show is, if I may share, or
Sure.
if you could, or I can try and share it so that I can show you exactly
Right.
slide I would like. So it's going to go to share screen. Hopefully it is going to select a window to screen.
Yeah.
Okay, this one. Yeah, I hope that's coming up to your screens at all, Varunji.
Still waiting.
Okay, please let me know when it is
Select
visible.
No, select the screen, and then on the bottom you'll see share screen or something.
Oh, really? Okay, sorry. I think said which one, but I don't think there is something like share next to
Just
the.
double click on that.
You're in the show. Oh, yes, allow. Sorry, I got it now. I've never done this before here. So select window or screen, it says, and allow. StreamYard, entire screen. I'm going to do entire screen
Yeah.
and allow. Yeah, I'm used to Teams and Zoom and stuff, but not this one. Yeah, so hopefully I can bring up the thing.
Yeah.
Can you see that now? Thank
Yes.
you. So this is the website from where I was not trying to. I mean, I was trying to get the best information we can in the shortest time and try not to invent a wheel. So I found this website, and thanks to Dr. Susie and this gentleman, Mr. Toby Morris, who have done illustrations which kind of explains everything in a very, very simple terms. I'm just going to pick up this first one. Okay, it's like flatten the curve. I don't know how many people heard about it. Right now, the peak infections. If you look at this peak of this way thing here, what do you call the mountain kind of thing? The top. If you think that is like overwhelming number of cases, and the line which is a dotted line is your healthcare system which can cope with patients. We've actually gone right up. So that's why we are struggling. So we have to keep the number of infections below the dotted line, which is the capacity. Say for instance, you can treat 1,000 patients, your infection should be less than 1,000 to be able to cope with this. And unfortunately, with the population of 1.3 billion, in an ideal world, if you're that rich and if you have all the resources, each one should have a bed, with oxygen and all facilities. But we are a country, we know what we are, and we are still growing, and we are budding to grow much more better in life. So we have to help this reduce this infections, and that is what I'm trying to do right now, to help that infection rate come down. Because if I'm not wrong, from what I heard, there were like 3 lakh infections a couple of days ago. I don't know the latest numbers,
Yeah.
but if that is continuing soon, that is going to be much higher. I just want to impress upon you here, the 3 lakh number may not be the only number. There may be much more number of cases which we don't know about, because they don't have symptoms, or because there is no facility to do the test. Okay. And the third point is very important, is sometimes despite having infection, because of the mutations or because of the strength of the test, in a simple word you call it sensitivity, you may not pick up the positive test. So people may need to get a repeat test. I don't know what the local policies in India are. I don't want to float a theory from my side, but I want you to understand that 3 lakh infections is 3 plus x plus y plus z. X is the number of people who are asymptomatic, y is the number of people who didn't get to get themselves tested, and z is the test itself not being able to pick up the positivity because the virus has changed mutations, or even the inefficiency of the test to pick all patients with all infections. So if 100 people go and get tested for an infection, they all have infection, the test may not pick up all 100 people as having infection. So that's what is called sensitivity. I don't want to go too much into those details, the scientific aspect, but yeah. So the aim is to try and flatten that curve so that we can cope with whatever resources we have. The government is doing what it can, and I think we have to appreciate they're not in an easy position. We have to question them, but please be kind to everyone around you, including our politicians and all the officials and all the colleagues, all the doctors and all the other staff who are involved in this mission. They are doing a great service. So let's be kind to everyone around and try and raise questions in a very gentle and a kind way. We want answers, but we just don't want to be blinded in anger. Let's respond and just not just react to situations. I That's my sincere and humble request. So if I can go down, there is a symptom grid which kind of differentiates between COVID-19, flu, and cold. I'm not going to go about there, but this kind, I think most of you know about this. There is cough, fever, runny nose, sore throat, breathlessness, headache, fatigue, body aches, diarrhea. Some people have diarrhea as well. So that is a simple thing. I want to, if anything, I want you to take away from today's my session. If I can really do something, is I want you to take away this picture in your mind, what you can do as a hero to prevent this infection from spreading. So if you can see this little one pink dot, that is the one person who is infected. Now imagine 3 lakhs of people plus X plus Y plus Z. Imagine this is happening with each person spreading it. Imagine the number of people. Can you imagine the number of people who are going to be infected because of this? So that is the reason why I want this to actually imprint in your mind that you can actually break the chain. So somebody is working from home, somebody is not attending to a party, and likewise, if you don't have to go out, please don't go out. You can break this chain of transmission of this virus, because I told you the challenges. One of the challenges, this virus is so smart because you cannot see it, and it is spreading this way, it is multiplying this way because it's passing on. But there are some good things, because everybody who gets infected don't have a bad outcome. 80% of the people are going to get better. They may have mild symptoms or moderate symptoms. Just because somebody had a mild illness, we cannot say everybody is going to have a mild illness. Somebody who's had a very bad outcome, we cannot say everybody is going to have that same bad outcome. So there are lots of factors that are going to contribute to the outcome of this. But I think we can break the chain. We can prevent the infection from going to other people and save lives. I have impressed people enough with this slide. I'm just going to let you see it without me talking for a second.
Yeah. I think this is really. Oh, there's an echo now. Give me 1 second. Okay. So yeah, this one is really, really impressive. Last night when we showed it, it really made sense. Okay, a individual can stop this from spreading like exponentially. So guys, Please, 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 take this very seriously. Your barbecue, your party, your get together, your birthday, it can wait. Especially इस time पे मैं ये बोलूँगा, uh, people in India, they really need to be mindful. Again, without politicizing anything, without talking about anything else, there are certain things that happened. मैंने रात को भी example दिया था. uh, you know we lost a music director, uh, simply because he did not listen and he went for the Kumbh Mela. कुंभ मेला की अगर हम वो पिक्चर्स देखें, I was shocked. I was literally shocked to see during COVID times how is that even allowed? How is that even possible कि इतने लोग वहां पर कुंभ मेला में, they were, yeah. So I mean, this was bound to happen. If you are going to be in such large numbers without any precautions in the water with each other, without maintaining any kind of, uh, you know, precautions, then of course this was bound to happen. And this was tip of the iceberg. I feel ये जो second wave कह के हम कर रहे हैं, ये second wave की जगह मैं तो इसको इस तरह से, the way I see it is, this was just a lack of that क्या कहें, this was just carelessness, shared carelessness on part of people. They had started taking, कितने videos आ रहे थे, लोग अपने, they were celebrating, they were having parties, they were having, weddings के लिए लोग इंडिया भी में, I personally know people who are traveling to India for weddings. So India में weddings अभी हो ही क्यों रही थी, I understand this is not really something that uh, that is really appreciated, but at the same time this is critical, guys. So I let Dr. Kala talk about more about it, but I
Sure.
think
Thank you.
let's be very mindful about this. Please go ahead.
Sure, thank you. So I just left that for a little while so that it sinks in, because this is where we can be outsmart this virus. We can stop it from spreading, and cut those numbers down, because those numbers of 3 lakhs now, it's actually going to, in 2 weeks time, it's going to get worse because of this spread.
Yeah.
So we have to stop it now, otherwise things are going to get much more worse. And I'm afraid this is the purpose of your lockdown as well, to break this chain. When you stop people from going out, and make everybody confined into their own homes, you're stopping the spread of infection, you're stopping this chain of transmission. So that's what that is. And these are alternative to the handshake. I'm not going to talk about that. I won't talk about this one. Yes, the lag. I think this is another crucial slide I want people to be take home this message from. So what cases you are seeing here, this little cases, it's from 2 weeks earlier. From not taking precautions 2 weeks earlier, the infections have come up now. So if we don't take precautions now, in 2 weeks time, this 3 lakhs, God knows, will be how many per day. Imagine. It grows exponentially, and how long does it infect most people? I don't know. I don't want that to happen, and that's the reason I'm here, just to share this little information so that I can impress upon people that you are a hero in this war, you are a warrior in this war against coronavirus. The little things you do are going to have a huge impact. You're going to break that chain of transmission, and cut down on the infection rate. So, whether, irrespective of what the decisions of the government are here, whether to enter a lockdown or not to enter a lockdown, I think they are in a better position than each of us, because we are common men. We don't understand the problems, and we've seen the suffering with the lockdown. And I'm sure they will take a decision, however hard it may be, if it is coming to such a worse state. So again, uh, that's about that thing. I'm not going to do much more than there, but I think I wanted to show one more slide, which is, see, all these slides are self-explanatory and easy. Okay, they are all available on this website. I think it's called the Spin-off. I think it's a newspaper online thing. See, this is one I wanted to show you. So on this axis, which you call the x-axis, it's like 1,000 cases, and here on your no, x-axis is the horizontal one, isn't it? Y-axis is the top one, isn't it, Varunji? Yeah.
Yes, correct.
X-axis is your time, like 1 week, 2 weeks, and your y-axis is your number of
Number
cases.
of cases. Yes.
So if there are like 1,000 patients, 80%, that is going to be 800 of them, will all recover fine. Okay, all these people will have mild illnesses or little moderate illnesses, but they will all recover. This is what is the information we have from worldwide. So 80% of the people, even if they get infection, they will recover. So that is the positive part of this viral infection, of this pandemic. The rest of it is the 20% of the people. Sorry, I'm just going to wait for this animation to start again. So yeah, so please go. Yeah, so the incubation period is about 2 to 10 days or up to 2 weeks. So people can have symptoms or may not have symptoms in that time period, and they start becoming unwell after that incubation period. They may have some small symptoms, and 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 the rest of the 20%, or rather, so they may have symptoms and they will recover very quickly by 2 3 weeks. But the 20% of the people, which is going to be equal to 200 people in this 1,000 population, they are going to have symptoms that can go on up to 7 weeks, and some of about 5.5% of these people are unfortunately going to succumb based on their morbidities, comorbidities, like whatever the physiological reserve they have, which is whatever, based on your age, based on your medical problems like high blood pressure, diabetes, heart disease, renal disease, all those chronic problems. People who have cancers, who have been treated with medications to suppress some infections like immunosuppressants, and all the people who are having long-term medical problems, essentially they are at a higher risk. So so this 5.5% can be part of them. It could be part of normal population as well. I would just like to impress upon you, this is a disease we are still learning more about, and this is the information we have, the limited we have information we have, and the scientists and stalwarts have come up with some solutions of vaccines. There are theories floating about vaccines and stuff. Again, there's another slide about it. But what I want you to take away from this slide is that 80% of people are going to recover and they're going to be fine. So we have to keep our positivity and optimism up, that you could be in that 80%. So there is no point in getting worried too much about it. So if somebody is having symptoms, please isolate yourself, get yourself tested. If the test comes back negative but you're still having symptoms, continue to isolate yourself and take advice from your local physician if they would recommend another test. I know there is difficulty in finding beds and everything, but as I mentioned in one of the sessions, you may have local facilities for physicians to do a virtual consultation. Like I said, people are very smart nowadays. Everybody is using a smartphone. So I'm sure there are numbers to communicate. So Varunji, my sincere request is, if you can probably at some point try and gather those information of any virtual consultations in every city, maybe you can
Okay.
just we can just do that for public in general, and people who have information can pass it on to Varunji so that he can put it at one place where it is being updated. I don't know, on your Facebook where you can pin it, or your Twitter account where you can pin it with all this essential information. And I know there is people on the social media trying to help with bed status as well. Maybe if people can contribute enough, because one person can't do anything. We have to be all together in this to help. So so we could do that. So essentially, I want you to take away the message that 80% of the people who may get the infection are going to recover, but unfortunately 5.5% of the people are thought to succumb from it. So if you think about 1 lakh population,
Mhm.
5.5% is about 5,500 people. That's a lot of people. And 3 lakh infections, think about it, 16,500 people. Imagine, this is 3 lakhs plus X plus Y plus Z. So that's the suffering we are seeing already. So please, guys, please break this chain of transmission of this virus and save people's lives. I'm sure if I can spread this, if I can convince you to do this, like sticking to the rules, using a mask when you step out, don't go out of the house if you don't have to go out. If you're going out, please follow those established local policies of that social distancing and washing your hands before and after you wear a mask and remove a mask, throw the mask, dispose your mask in a responsible fashion, and then like isolate. Obviously, don't try and go on to public if you have symptoms, because you're going to spread that, unless really really important. If there's somebody else who can help you, like a friend, next door neighbor, you can take their help. Equally, if you are not having any symptoms, you can be still another hero by helping your neighbors. If you live in an apartment or somebody, there is a gentleman and a wife, a couple who live there, and she has heart disease and he gets infected. He can't go and do anything, she can't do anything. So maybe if somebody can help them, he will continue to stay in, because I heard about the situation in my parents' place. That's why I'm quoting this to you. So if there's somebody who's got an infection and is moving up and down because he has no choice, there's nobody to help him. So maybe if you can think of ideas to help people in that fashion so that they don't come out, if they need some groceries or medications, you can still get them and leave them in a bag. I mean, you don't have to talk to them, don't meet them and stuff. Just put a bag outside, and I'm sure you guys have lots of ideas how to do that. And doctor, not doctor, I don't know. There was a lady who was suggesting something yesterday. Think outside the box. I'm sure there will be lots of ideas about this. So think about that 5.5%, which is equal to 5,500 people for every 1 lakh population. And this infection is not from what happened yesterday; it is from 2 weeks ago. And imagine what is the situation going to be 2 weeks later if we don't do this, breaking the chain, because we don't have a lockdown. We can self-impose a lockdown upon ourselves and not go out. I think that's what the government is try to tell us as well. If I'm not wrong, correct me if I'm not, and also stop me if I'm saying anything which is not right. I'm trying to keep it very, very basic. I'm not going to go into the depths of scientific things at all here. I think I showed all the three things. I just wanted the session just to impress upon you that we have to see there are various explanations about vaccines, everything all the way down. So my thought process is only with three things. Oh, there is one about the face mask. Sorry, yeah, there's one about a face mask. I want to show you how the face mask is going to help, which is probably further down. Sorry. Uh, Sounded by contact tracing, the vaccine. Let's go. I think this is the one. No, sorry. That's not the one. This one. Okay, I'm just going to leave that graphic to go on, and it's so self-explanatory.
Mhm.
I think it's coming towards the end now. It's just going to start. So they say, wash your hands before and after putting a mask off. And please don't touch your mask. Yeah, don't keep fiddling with it. And make sure it covers your nose, mouth, and then going below your mouth as well. And they recommend not to wear a mask with a valve, because you can people around you with that. So so here nobody is having a mask, and this lady has got infection and she's coughing, so he's got a high risk of catching the infection, because both of them are not wearing a mask. Here the man has the mask, so he's still got a medium risk because she has no mask. Now she's got a mask, and he will also, I mean, the risk is low because it's kind of preventing that infection from spreading around. That's the low risk. And then both of them have a mask, that becomes very low. I think I'm not going to say anything and just let you see that later on in your own time if you like. Or
Okay.
we can probably give them a time to just see that, so that they are not confused as well. So the importance of the mask, why the mask. um,
I'm just putting up some of the questions, even though we want to hold off, but I'm just putting something on the screen if you want to answer.
oh, sure. um, I think I'm going to let this finish and then have a
Sure.
look. Thank you. Yeah, so the transmission is very, very low, so you're trying to cut it down. So I think I just wanted to show those two three things. I think one of that one about the 5.5%. uh which one is that? Which is the second one, about the fatality of this virus, that people are succumbing about. Okay, I think I've lost it. But anyway, this is the crucial thing. You can be a hero. You can be that hero who is working from home. You can be that hero who is not going to the party, that hero who is not flying locally in the flight, and the rest. So please, please, please do your bit to stop this virus from winning over us. So uh, yeah. So that's their website, the spin-off. And now I'm going to look at your questions. Should I stop the screen? I
Yeah,
think
stop
stop.
sharing.
Right.
Stop sharing.
Thank you. Thank you.
Thank you. All right. So Neha is asking if the nose is running and is nose running and no throat irritation still.
Good question. I think it's not very sinister from what it sounds like, but I think even runny nose could be. You don't know. Today it is simple runny nose. It may progress. You see. So people. So you never know. So take the precautions. Wear a mask. Try and avoid going outside, and stay within your room and see how it goes. I mean, all the upper respiratory symptoms. I mean, people are considering it. I think because we don't have like so much of information, but we have this preliminary information. If you reflect back on that slide and also go to WHO, I think there are lots of information. I don't have that screen up, but WHO has also given a lot of information. There is a lot of information around, guys. It's just picking up the right kind of information. So it could be an early stage. You never know, because without breaking too much of confidentiality, my next door neighbor,
Yeah.
I was talking to her for 15 minutes or less than 15 minutes, and I was so worried that I was going to get the infection because I was on the high risk group. But
Yeah.
anyway, I'm grateful it didn't. So the contact time is about 15 minutes, even if you come in touch with somebody. But if the contact time is less than 15 minutes, again, the chance of spread are lesser. So I think it could be. Right now, anything and everything, everybody is considering a differential, what we call a possibility of a coronavirus. I know there are scams going on. I know there are bad people who are not doing the right things as well. But what you can best do is use a mask and use a tissue and throw it in a bin. And when you have a cough or a sneeze, use your hand to prevent it from spreading widely. So there is no right and wrong answer to this. It's all about us being smart and not worrying too much. Like I said, be positive, and maybe it is something, maybe or may not be. But what can you do to prevent it from worsening? You can use these precautions from spreading it to others, and it could self-resolve. Yeah.
Right. And I just pinged the URL in case somebody wants to join and ask any question. Sorry. Yeah, I've just pinged the URL in case somebody wants to join and ask any question. But first of all, Dr. Kala, I really want to appreciate, for you to share, these kind of updates and these kind of, this information with our people. A lot of people who would be watching this video later also would be, of course, they'll be helpful. It'll be helpful for them. Now, the other thing, people were asking earlier, yesterday or last night also, if they have to reach out or if they can get some kind of basic guidance. Is there any way that they can reach out to you directly, or do you want me to kind of be the facilitator? How do you want to do it?
Right. The thing is, it depends on, I mean, because I am not having any, what to say, I don't have any opportunity to facilitate stuff like, I cannot manufacture oxygen, I cannot provide beds.
That right.
um, but maybe I can help with some information of doctors who are locally around.
Okay.
If I can find some information about virtual clinics and stuff, I can give you that information.
Okay.
But I can give this basic information, the little steps, like how you can stay at home and how you can use a mask and how you can prevent this exponential spread of this infection. We have to break that chain. I want to focus on the public health aspect of it. I know
Mhm.
there are like great heroes around, like Ramanji, who's trying to help with all the medications, oxygen, and people who are heroes who are actually coming forward to give their plasma. Again, these are all complicated, complex things. So please get in advice from the appropriate specialist and before you jump in, because there are people who are malicious and also selling things which are not what they are, from what I could hear. So
Right.
people say it is remdesivir, but it is not.
Yeah.
So that is unfortunately the scene there. So don't get cheated in the situation. And I hear very awful things about how expensive oxygen is and how difficult circumstances are. And I'll be honest, I didn't see the I'm I was very heartbroken seeing the unwell people actually on the trolleys when I knew there was no oxygen, when I knew there was no facilities, that was enough. And then what Varunji put up on the screen actually made me like shake. I haven't seen those images. I haven't seen that, but my consciousness was touched to come out and try and do my little bit, like a squirrel in the building of the Rama's bridge. It put a little stone. So I'm just like that. I'm a very tiny dot. I'm little grain of sand on the ocean beach, just trying to do my little bit to help people get this information and how they can spread and how we can help together to prevent this infection from taking its toll on those vulnerable people, those 5.5% of people who can succumb. So we want to stop them from getting infected, you see. So that's what we can do. Yeah,
Right.
sorry.
I'm going to take this as the last question. What are the absolute underlying conditions that I should have to visit emergency room when I'm having symptoms?
Is this about the coronavirus?
Yeah.
I think so, isn't it?
Yeah.
um, Absolute underlying conditions that I should have to visit emergency room when I'm having symptoms. That's like a big question, in many ways. See, I hope you don't have to go to the emergency room. Number one, if you are having underlying conditions that puts you at a high risk, please take enough precautions so that you don't have to go out. Okay. So from what we know, people who have, this is not about answering this exact answer to this question, but this is a general information. People who have diseases, chronic long standing diseases like high blood pressure, diabetes, heart disease, they all carry a small risk. It is not absolute. Just because you have that, you're going to have a very bad outcome. No, they are at a high risk. And nobody can tell you where you are on the side of that equation, whether you are on that 20%, 80%, or in that 20%, are you in that 5.5, or are you in the rest of the 14.5? So it is difficult to say. But if you think you're getting unwell, you're getting worse, you can call help. And there are physicians who are coming home and checking you whether you need hospitalization. This is what I heard last about what they're doing in Hyderabad, and I'm sure a lot of other places may be following suit. I think there is a clinician who comes around and visits home. I don't know how long, I mean, how many places are able to do this. But if you are breathless, you're out of breath, you're dizzy, I mean, these are all the things which are like very sinister and you're not able to catch your breath, then yes. But if you walk a little and you're short of breath and you settle down and it goes away, that shows that your lungs are getting infected, but you have the reserve to cope. So it is very difficult to answer what is the absolute thing you must do or you shouldn't do. It is individual on every patient and how they manifest. So if you think you're getting worse and not getting better, definitely you should seek help. If you're so bad, obviously call for an ambulance and go and visit a hospital. But if you, because in yourself you will know where you're heading, and you have to calm yourself down. I think the most important thing is to calm yourself down in that situation. I understand anxiety as a patient as well. So it clouds your mind and you can't think clearly. So take some deep breaths and focus on your breathing. That calms your nerves as well. And then think, is this my fear or is this my real symptom? Do I have to go to a doctor or can I phone them? Because everybody who's testing positive, if everybody goes to a hospital when they don't need to, that is going to overwhelm the support systems we have as well. So, like I said, you could be in that 80% of people who are going to just get away with a little illness, even if you have underlying problems. And it's very difficult to predict. I don't think there is any way you can predict who is heading in which direction. Even if it for me, it's difficult to predict. I know I am high risk, so I haven't even worked in the last 1 year. I'm working from home. I have that facility and opportunity to do that. But okay, it's a battle. I'm not going to go into those details. But you have to do what is right for you. So
Right. Okay. A couple of more questions have come in, so let me just quickly go through it, and maybe we can wrap it up. How far it is possible to get COVID-19 after the two shots?
well, this is a very good question. um, Sorry, can you please put that question back on the
Sure, sure,
screen
sure.
again for me? Because I just looked away and I forgot what the question is. So, how far is it possible? So, I don't know what do you mean by how far is it possible, but if the question is it possible to get COVID after
Yes,
having two shots? If that is what is the question,
yes, yes. I
I
think
would
that's
say
the question.
yes, there is a possibility of getting an infection because the virus is getting smart. I think I mentioned this. It is changing what we call the mutations. I haven't gone into the depth of it. This is a huge science, so I didn't want to overwhelm anybody. But the virus is changing its nature to keep itself progressing. You know, it wants to survive as well. So it is doing all those mutations and stuff. So you may get an infection from a virus which has mutated, or it could be something else. But there is a chance. If the answer is, can you get it? Yes. But the benefit of having a vaccine, from my understanding, is the outcome may not be bad. So this is what it is. So the severity of the illness will not be there. Besides, taking vaccines is going to improve the immunity in the community itself, so that these vulnerable people, even if the virus is there, it is bouncing off because of the strong people with their immunity, so those people don't get infected. If I can show that picture at some point later, I can do that. Yes. So this was I haven't really planned the session, so I've just come up with just gathering my thoughts, because I thought I want to impress upon you, upon breaking that chain of transmission of this virus, to think about the numbers we are having right now as an infection. It is 3 lakhs plus that X plus Y plus Z. We don't want that to go further. We don't want that to go further. We are all smart. We are all sensible people. And I think we can win this. We can win this. Don't worry about anything else. Just be positive. Prayers are very positive. So keep everybody in prayers, and my prayers are with everybody, and I'm praying for everyone. And my sincere condolences to all the people who have unfortunately succumbed to this illness, and all to their families as well. But what we can do is prevent this from happening to anyone else. So we can do this. We can do this together. We have to cooperate with the governments. Question the governments, ask the questions, but do your basic things. Don't go out in the road and don't wear a mask and say, I'm going to question the government. That is not right. I'm sorry, I'm going to answer this question, but before that, I just remembered, for people who don't believe this is real, I think I mentioned this, right? Like, think about the science. If you trust science, if you trust technology, if you use science in your life, please trust science. That is my sincere request. Have an open mind. Why are so many people dying? Why are so many people suffering? What do you think is the reason they're suffering? If you didn't believe there was a HIV, are people adopting all those precautions? If you didn't believe hepatitis B and all that stuff. So this is science. We have to accept science, and we can question people later if this is not true. We can always ask them questions, but for the moment, kindly, please follow the rules. And coming to the question of soundscapes, asked to overcome anxiety and panic attacks. Yes, ask me about it. Yes. So this is a true thing. Anxiety and panic attacks are true. And to overcome this, you have to understand why you get this. So essentially, your anxiety and panic attack is a situation where you're so worried when there is no stimulus. Like, for instance, say you're worried about a tiger. So there is no tiger there, but you're already scared and you're frightened. You're having the heart racing and your hands and feet are cold, and you're not able to think clearly. I'm just saying it as a simple example. So there is no tiger, but you're worried. You know what I mean? So that is what is anxiety. So it's good to have anxiety, because if you touch fire, it's going to burn you. Yeah. So if you live in an apartment, which is in these countries, you are not supposed to leave candles and stuff like that, because you want to prevent a fire, because there is a risk of fire, kind of thing. So I don't know why I'm talking about that now here. Yeah. So the anxiety is, you'll take precautions. So if you have anxiety, you're going to take precautions. So if you're worried about a tiger, you're not going to walk in a forest. If you're worried about getting burnt, you're not going to touch fire. So you may have anxiety to certain things. So try and understand what is the situation that is giving you anxiety. So, like, if you're scared of flying, like I am, but I can't live without seeing my family, but I still have to fly. Otherwise, I cannot walk or not take a seat. So I still fly, but I do my best about it. Like, I go in the best airlines, and if anything happens, it's outside my control, but at least I tried to protect myself. Similarly, whatever gives you anxiety, think about it rationally and do what you can do to protect yourself, and stay in the moment. And mindfulness and meditation helps. And I can probably give information to Soundscapes because I see him in Rachna's show as well, or I can give you that. So
Yeah.
yeah. Oh, I'm so sorry, Soundscapes. I never got an opportunity to say this. I just seen the message there. I'm really sorry for your loss. And what can I say?
Yeah.
So she must be proud of you, watching you from above. Okay, remember that. And she's still a part of you. You're a part of her. Even if she's not with you, you are connected with her, and she's watching you from above, or she's already there in some other form connecting with you. So remember, she will see you, she will be proud of you to see you strong and functional in life, rather than becoming a little unsettled and maybe dysfunctional kind of thing. I don't want to go down that route, but yes, but it is understandable that in a very young age you had to go through this trauma. I have lost my husband, and I understand what it means to lose somebody you love. So my sincere apologies and condolences, but please stay strong. You're a smart boy, you will get there. And your father, he doesn't have to increase your what is that, pocket money. Soon you are going to earn money yourself, I'm confident.
Yeah.
So stay
Sorry, Doc, I
strong.
didn't
All
know
the
that.
best to you.
Sorry to know about your loss as well.
Yeah, Varun, so many things happened in life. I never expected it as well. So, but I accepted this is part of life, you see. I've lost him when I'm in my 30s, and this is nearly a decade ago now. And I've dedicated myself to my career. And emergency medicine is the reason why I do emergency is this, because I want to make a difference to somebody's life in those crucial moments. He had an MI. Sometime I can talk about all those things later, but for
Sure.
the moment, the reason I'm passionate about this, or why I live in this country alone, is because I don't charge people for seeing them. Nobody gets denied treatment, whether you have a heart attack, stroke, cancer in this country. There is a free service. Everybody gets treated the same. There may be some problems here as well. Touch my heart because I can never take money from anybody. So I can't come back and stay in India. And this is the decision I had to take. I said, the world is a small place. My parents, I can just fly in 10 hours and meet them. But when COVID happened, when we couldn't fly, I panicked. I panicked, and I've been through some difficult stages, but I'm coming out of it. I'm having help here. I'm taking help, and Rachna was also very, very helpful, I think, in many, many ways. So I appreciate you doing this kind of different, varied things. Despite being a doctor, I'm still a human being, and going through so many traumas doesn't help. I suddenly lost him, and then they misdiagnosed me with cancer a year later. And then before around that time, my email got hacked,
Hmm.
so that gives me palpitations to be on the social media with my information. That's why I tend not to come out. And also, I did mention about what happened recently, right? In November, somebody put my email along with password in the public domain. I got that alert from Experian. We have a software, we pay them monthly money, and they give you the alert. And I told you about a comment I posted, and then somebody said, this is how you hack an email or something. So there's a lot of sinister things going on. We don't know about people. We are good people, we think everybody is good, but we don't know who is good, who is not so good. Someday when I'm very brave, I will show my face and I will tell about myself, but for the moment, please bear with me.
Sure. Okay. Couple of last questions. Okay. There's an echo now. Let me mute you. Uh, is it safe to take vaccine for heart patient having pacemaker or yeah, it's safe.
Okay, right. Good question. I think people who are vulnerable can take a vaccine. I don't know about when this procedure was done, but please consult a physician who is local to you. You must be having a doctor who looks after your family member or whoever is having this condition. Please do not take any advice from unknown people, even from me for that matter. Please have a responsible person who is accountable for what they are doing. So even if I say something, just don't blindly follow it. I mean, I'm going only with basic public health information. I'm not suggesting any treatment, so I'm confident about that. But vaccine, yes, they can. From my understanding, yes, they should. But whether there are any contraindications to that, because there can be reactions to that and stuff like that. So please consult a physician under whom your family member is taking SIA, please. And I'm sure they're going to recommend yes. And I just wanted to say something here. People are trying to blame vaccines here, saying I've taken a vaccine yesterday and I got corona today. so the vaccine gave me corona. No, I'm sorry, the infection doesn't happen like that. There are like 2 weeks window period, that incubation period we talked about. Once you get infected, it takes about 2 weeks for the symptoms to manifest. So if you're having a symptom one day after the corona or the vaccine, it means you got the infection 2 weeks before that. It's not the vaccine that is giving you. Again, vaccine has side effects, and there are other things about vaccines. I'm not going to touch upon that, but it's understandable. People are having all these fears and myths and things going on. I think Dr. Susie Wiles' website has information on vaccines also. It explains. And most importantly, I forgot, there is a resource I found yesterday when I was looking. It is called Professor of How. And that title, I don't know, Varunji, if you've seen it. I sent it on your Twitter. Essentially, it talks about how coronavirus is killing people.
Hmm.
The title is scary, but the graphics and everything is in Hindi. It is in great detail. I think it's about 15 minutes. And after that, he's done another video called How Vaccine Kills the Virus. There are two videos. So, see the first one, like how coronavirus is killing people. I'm sorry to say that. I don't like that statement, but yeah, that's what it is all about. It's not very scary, but it is like in graphic detail what exactly is happening in the lungs, how the virus is going. It's a beautiful piece. It's a beautiful piece. I would recommend that for people who want to watch it in Hindi. I don't know if there's any equivalent in English for that. And the second one is how the vaccine kills the virus. The second one, I watched both of them. It was a bit funny there. Once the doctor is jumping and the patient is like having a convulsion or nothing, but it's only animation, of course, that they discovered the vaccine or something. But otherwise, it was very, very sensible. So please do watch out that. I'll see if I can send that link to you, Varunji, later,
Sure.
and then you can flash it on your tweet, or you can post it on this comments, I guess.
Okay.
So
All
you
right.
can just Google
I'm
search.
gonna
Yes.
I'm gonna quickly, last, I think, now the people have started joining, and there are a lot of questions, but I'll try to wrap it up very soon. Are
Sure.
smokers more vulnerable in COVID-19?
Are smokers more vulnerable in COVID-19? See, that's like a big general question. I'm not an expert to answer that question, but from
Mhm.
what I understand, if you've been a smoker and you've been smoking for a long time, there is some damage to your lungs. That's what smoking does. Besides the increased risk of other diseases, there may be an underlying damage to the lung. I'm not saying everybody's got the damage again. There may be few people who have damaged their lungs. Maybe some people are lucky they haven't gone that far. So to answer that question as a blanket is not a right thing to do. There is a risk, but I haven't heard anything specifically about it, though it makes sense and it worries people naturally. Giving up smoking is good for you, irrespective of whether you get coronavirus or not. There are so many other benefits. So I'm
Sure.
sorry, I haven't got more particularly.
Yeah. And second last question: do these oxygen units drawing the air from the normal atmosphere really work? Is it really enough oxygen?
Excellent question, Ashnurji. Um, I have bought this one for my mom in 2015. I have used this for my mother. So it was very expensive those days. It was like 65,000. I hope you're mentioning the same thing. It's called an oxygen extractor, which is like a little machine you have at home, and then it concentrates the oxygen from your room air. I unfortunately don't have how much high it can go because the normal percentage of oxygen in the air is 21%. But people with coronavirus, because of the lungs getting damaged, they are needing more amount of oxygen. And the oxygen you are giving is in concentrations of higher than 21%. So 30, 40, 50, based on the clinical need, the doctors are going to decide that. So unfortunately, I don't have the information how much high it can go, but it's definitely, I think it can go up to 35, 40%. I'm sorry, I don't have the accurate answer because um yeah, I can find out and let you know.
Sure. Okay. And the last question before I take Sachin in: how can we improve immunity for kids and 40 plus people?
Oh, excellent question. I think this is something we can do to protect ourselves, how we improve our immunity for kids and 40 plus adults. I think number one, what we know about is vitamin D. Vitamin D, we all are ignoring vitamin D in our lives because we don't go out so much and we are all using cars and all that stuff. So vitamin D itself is quite deficient in many of the people, and I was severely deficient as well. So getting to know your vitamin D status and supplementing that as needed would be good. at this moment in time, I would not recommend you go and get a vitamin D test when there is overwhelming need for other reasons. Like, I don't think there are labs people as well. You don't want to get yourself exposed to that risk. So maybe at some point it is good, but having some vitamins supplementation like a daily requirement multivitamin, I think doesn't do any harm. Again, children, I don't know how young they are, so I don't want to give a blanket thing. Please consult a physician and take advice. They may say yes, take one. Okay, because some of the vitamins can be stored in your body and you cannot take too much of those vitamins, and vitamin D is one of them. So there is a good and bad to everything, you see. So every advice has to be tailored to every person, and generally I tailor my advice to every patient I see. Like, it's a customized advice, so I don't give a blanket advice kind of thing. But it is good to take vitamins, especially vitamin D, and the vitamin C is what are people saying. And the other thing is eating a lot of fresh fruits and vegetables. They are full of antioxidants and nutrients that can help your immunity as well. Calming yourself down and de-stressing can help your immunity as well. um yeah, I think, yeah,
All right.
sleeping at least 7 hours is good.
Which
Yeah,
is, yeah, which is not a common thing these days, but yeah, that's also
absolutely.
very important.
Yeah.
All right. I'm going to take Sachin. So Sachin, please go ahead. Almost time to wrap up. Let's
Yeah,
see.
yeah, yeah. Jai Shri Ram.
Yes, Ram.
Uh, Kalaji, hats off to you for sharing your vital information with everyone.
Jai Shri Ram, Sachindi, thank you so much. Thank you to Varunji for giving me this opportunity to do this little help,
Yeah,
and
yeah.
thank you to
Actually,
all of you to
actually
listening to
appreciate
me.
Varun. Yeah,
Yeah,
yeah, because he's giving platform to several important topics right now which are going on, and
absolutely.
COVID is one of the most important right now because every day we are having almost 3.5. Now I think today it will reach around 4 lakh cases per day.
Oh my God. Yeah. So
So
imagine
yeah,
we were talking about it, right, Sachinji? Like,
yeah,
that number is going to go much more higher. I think we should
yeah.
expect that to go to at least more than five to
I
six.
won't be surprised if it hits 10 lakh per day
All right.
Yeah.
because
No, no, no. Let's not. Let's be
Okay. Let's
no,
positive
no,
not
around
no.
these
guess.
things.
As we are seeing the kind of rise that it's
Yeah,
having, uh, luckily, I
that
think from
is.
May 1st, everyone is going to get a vaccine. So
Yeah.
everyone above 18 is going to get a vaccine. That's a good thing. Madam, I would like to just ask one question to you.
Sure.
Probably
Sure.
another one. This
No
is the first
problem. Please,
question.
please. Yeah. As long
Yeah,
as Varunji doesn't have a problem,
Yeah, yeah, yeah. Please go
I'm not
ahead.
yeah,
rushing
yeah,
anywhere. I'm happy to help. Yeah.
yeah.
If it helps
Yeah.
anyone.
I mean, yesterday I saw in some video on Twitter that you could use your nebulizer as an oxygen cylinder. I mean, as a source of oxygen. Is it true?
Well, I don't think so, because the
Because
nebulizers usually.
that person, he should. I'll just complete. That
Yeah.
person, he gave a demo. Like he told that just you do not put any medicine inside the nozzle, and
Right.
you just put the oxygen mask and just on the nebulizer, and it will work as a no it will I don't know what exactly he said, but it will work as
Right.
a source of
Please,
oxygen.
please share that video with the Varunji, and I can see it as well if you can put it on the comments. Normally, the
Yeah,
nebulizer, the how it works, if I may say so, it is driven by air, room air, or it can be driven by oxygen supply. So, a nebulizer does not create oxygen from the air. So, if there is a supply of oxygen connected to the nebulizer, you can get extra oxygen. But if it is running by air, it is not going to make any difference. The percentage of that vapor kind of thing, if you get anything, or I don't know, it's probably the calming effect of that little buzzing noise for people to think it's extra
no,
oxygen. I
he
don't.
said that there is no need to put any medicine because medicine is going to create that vapor effect.
Yeah, yeah. But if you, but how did he explain that you're getting extra oxygen? Where are you getting that oxygen from? The machine creating the oxygen?
I mean, that is what he was suggesting.
Nah, I doubt it. I'm sorry. I doubt it. I would like to see what it is, to see if he's
Yeah,
invented something new to create oxygen out of a nebulizer. We don't know technology.
yeah, yeah,
But from my
yeah. Because
understanding,
I actually, what I wanted to was I wanted to share that particular video in my WhatsApp group. But before doing that, I wanted to consult a doctor. So luckily, I've got you.
you're
And
welcome.
yeah, because
Thanks for sharing that.
any sort of
Yeah.
misinformation if I spread, even to my WhatsApp group.
Yes, yes.
Yeah,
Dr. Susie in her in her illustration, she talks about this how information is spread as well as wrong information spread as well, like a pandemic. That information goes. So you've done an
yeah,
excellent job not sharing that information, because we
yeah,
shouldn't share information that is not true, which is not verified. So excellent, well
yeah,
done.
yeah.
Yeah,
And
I
another
think I've
question,
seen
madam. There
that.
are actually, yeah,
Go ahead, please. Please go ahead. Go ahead.
yeah. There are two vaccines right now: COVID Shield and Covaxin. Recently, the people who have produced Covaxin and even researchers have claimed that Covaxin is much more effective than COVID Shield. So the people who have already taken the first dose of COVID Shield, is it possible for them to take Covaxin the second time, or they have to take second dose of COVID Shield only?
Mm, very good question. Yeah. Unfortunately, I don't think you can take one dose of Covishield and one dose of Covaxin. Again, I'm not an expert on these matters, but from my little understanding, it doesn't work that way. Whatever you have taken the first dose, you have to take the second dose to build
Correct.
that immunity response. So, and
Yeah,
I heard about Covaxin being actually helpful even in the triple mutation that is happening. Again, I haven't read any literature. I haven't gone through it. It's just a hearsay. But yeah, I'm just going to stop myself saying anything more than that.
I mean, what is the basic difference between COVID Shield and Covaxin, madam? I mean,
I can do
what
the separate
exactly is it?
session on it, because
Yeah,
I don't want to tell you
yeah,
something which I don't know about, honestly. There are
yeah.
two different
Okay,
types of vaccines. One is your inactivated vaccine virus, which is given as a vaccine, and the other one is the technology where they have used. So I cannot explain that very simply, but at some point I can touch upon topics and do a more streamlined, more regular, more helpful sessions. This was just an emergency break kind of thing, when you have to rush and do something. And so I said, yes, I will do this. But at some point, I'm quite happy to talk
yeah,
about that once I learn more about it. And as we know, those are
yeah,
trials going on, and the scientists who are working on them still are learning. So these are like unprecedented times, and they are trying to help people, because you want to save lives. And there may be some side effects and risk factors, stuff like that. So we have to eliminate those things, take the people out of that equation, and give those people who can take it. So things are changing very quickly. So what we know today, it may change tomorrow as well. So I would like to really spend some good time on it before I can tell you anything about it. And I'm sorry, I don't have more than
yeah.
that to say on this.
Madam, do you have any like suggestions for prevention, like especially Ayurvedic medicines or any homemade remedies which can be taken for
Honestly,
prevention?
God, I don't know there is anything existing. If it was, they would have been like billionaires by now.
Not,
But
not exactly a cure, but a prevention kind of thing, like to boost your immunity.
to be honest, I tried to get some homeopathy for my father when he was unwell, because they have a lot of faith in homeopathy. And I have respect for all types of medicines. I don't want to belittle anything because I don't know about them. I don't want to say they don't work. Okay, I am into this medicine, but I was curious to learn what they do, because I think we have to change our lifestyles and stuff, and probably there is a role for them. But unfortunately, I have no information on how it helps. But hearsay, anecdotally, I heard somebody has taken something like a homeopathic dose and they got better. And like I said, in my family, my father, my mother, and my sister, they all have some faith in homeopathy, so I cannot discount that. Yeah. So
All right, great. I think what we'll do is, Doctor, we'll do another session more on the vaccine and how additionally we can look at COVID. I was just looking at some numbers, and numbers definitely don't look good. 3 lakh, almost 3 lakh cases in one day. Uh, but again, I don't want to just spread the negative thing. uh, the statistics also show, and I'm just speaking specifically for India, out of the total number of cases till date, 99% of the people have either recovered and discharged. There have been about 2 lakh, close to 2 lakh deaths, but again, I don't want to discount that every single death is a death and it matters. But what I'm trying to kind of show with the data that I see in front of me is, out of the total number of cases, about 99% of them have either recovered or have already been discharged. So I think let's keep the hope, let's keep the positivity around it, and let's I think even yesterday. Okay, I see Vinita join as well. Hey, Vinita.
Hi,
Hello.
Varun. Can you hear me?
Yes, on time.
Hey, it's a good topic. I am actually at NYU Langon right now because I have to come here every month, or sometimes more than every month. And that's the reason why I joined, actually, because I wanted to give a perspective from somebody who's had a solid organ transplant and somebody who is immune suppressed. Somebody who takes medications specifically to suppress immune system so that the organ doesn't get rejected. And because we people like me come under we've always been living under this sort of stress where what if you want to call it stress, that oh, we could get sick anytime, anybody coughs around us, we get sick. And I have personally landed in hospital many times because my little girl, toddler, came home with a simple cold, and it came to me, and I ended up in the hospital for not just a little while, for a month. So this is just that perspective I'm trying to offer from somebody who is living with that, and the way I have dealt with it, because that has happened even before COVID pandemic came. So the way I have lived with it is do the best you can in your circumstances. There is no answer that is one size fits for all. Everybody has their own reality, everybody has their own circumstances that they have to live around. So the way I have always viewed it is I do the best I can. Every possible thing I can do, I do. And the remaining, I leave it on time. I leave it on universe. I leave it on God. I have the belief that जो भी होगा अच्छे के लिए होगा. And so I take care, I take all the precautions, but at the same, like, I listen to my doctors. I believe in medical science. I totally believe in, and those are the doctors who saved me. At the end of the day, they saved my life. Their medicine, their method saved my life. So I trust in them, I believe in them. I don't sit around questioning their degree, because I'm not a doctor. I'm no one to question their degree. So I just listen to them, listen to their advice. If I have questions, I ask them questions. But at the end of the day, if people do, everybody does what they can, the best of their abilities. We can ride this wave. Ask people who live like this for a long time, like us
Yes.
who have had solid organ transplants, cancer patients. It's not impossible. It's not
Yes.
impossible. We do it every day.
Yes.
So that's
Very
all
well
I
said.
wanted to share.
Very well said, Vinita ji. And sorry, you're Vinita, isn't it?
Yeah,
Yeah.
Vinita. Yeah.
Yes. And I'm sorry about that, but see, science has helped you. You had
Mm.
a transplant and you're having a life, but it comes with some perks or some
Yeah,
disadvantages. So
like
you
I'm here every month at NYU Langon
Yes,
to get
so you
labs
can't
done. Yeah.
stop that bugs coming with, especially with children when
Yeah,
they go to nursery and come back, they bring it, but it is not good for you. So you can't stop sending your child to school, right?
exactly.
So
Yeah,
you're
it's
doing
like,
an excellent job
yeah,
that way, and thank you for coming forward and sharing that information. Each one has got a challenge. Nobody is having a bed of roses in this world. Trust me,
exactly.
everybody's got their own problems going on. Everybody's got their own set of challenges going on. We just
Yeah,
don't understand them. So for us to be brave and do what little we can do, as like I was appealing to everyone to be a hero in this war against coronavirus by doing those simple things we talked about, like wearing a mask, like how you are wearing a mask,
yeah,
and following the rules, and have faith in your systems, in your organizations, in your politicians, and question them certainly. But at this moment in time, I think more than questioning, we have to follow those rules, and maybe question as well, but please follow the rules. Don't break those rules. Follow the rules, question whatever you want to question. I'm not going to stop. And the
yeah,
people who don't believe COVID is reality, please think again. Why is this happening? Why are so many people dying? Why are so many people suffering? Have an open mind. If you have faith in science, please reconsider your decision. Even if you don't believe it is true, please follow the rules. That is my sincere request, and save lives, please.
yeah.
Thank you.
Because people like us suffer then. You might be strong
Exactly.
enough. You might be
Exactly.
perfectly fine. You might not even feel it. But when you give it to people like us,
Yes.
it's like, I'm a mother of a 5-year-old. If I die, my child is got
Not
no,
say that. Yeah,
doesn't have
yeah.
a mother. So it's as real as that. It's not, it's, people who have a strong immune system can probably get through it with no problem.
Yes.
But it's people like us who will truly pay the price for it. And I don't expect the world to live my life and try to go live in a shell or in a bubble. But just simple, there are a few simple things. Like this, for example. It's annoying. Yeah, mask is annoying. But is it really the worst thing ever?
Yeah,
I
I
mean,
know.
it's not. For a little bit, you have to deal with this thing on your face. Your face gets sweaty. Okay, so what? Big deal. That is
Yeah.
how I look at it. If it helps somebody, because if they live as a result of me being annoyed for a few hours, fine. It's a very small price to pay.
Yes, very well said. Thank you.
Very
Thank
well
you for
said.
coming forward. It is like preventing the infection. Sorry, going to people like Vinita ji and other people who are at high risk. So what you're doing is stopping it from getting infected.
Yes.
Sorry, I think there's a lot of background noise going on there from here. Anyway.
Thank you
मैडम
again,
आई जस्ट वांट
Vinita,
टू
for
आस्क
coming.
एक आखिरी सवाल है वरुण जी।
हाँ, बोलो सर।
बहुत सारे ऐसे कंपनीज है, फार्मा कंपनीज है, लाइक रिवाइटल बोल के कोई मेडिसिन का ब्रांड है, आई डोंट नो विच कंपनी का है। वो बोल रहे हैं कि आपका इस कोविड के टाइम में आपका इम्यून सिस्टम बढ़ाने के लिए इसमें कैल्शियम है, इसमें जिंक है, इसमें ये है, इसमें वो है। ओके, दे आर ट्राइंग टू प्रमोट that it can boost your immunity. I just wanted to ask the doctor how far the claims are.
See, good nutrition is always good. Okay? You can take it in the natural, most natural form. That is ideal. But taking a supplement in itself, it doesn't discount that you should avoid eating your food. So if you can eat normal food, why not eat normal food? And I'm not going to promote anyone here, but I think vitamin D is known to help, and vitamin C is, and zinc and other micronutrients also help with your immunity. But if you're eating normal food, I think they should all be okay. I don't think you will have any deficiency if you're eating your food normally. So I'm
Okay.
not against supplementation, but like I said, I don't want to give a blanket advice.
Yeah,
Yeah,
thank you.
Dr. K, I want to add with to you on that.
Sure.
This is because I've being a patient for a very long time means you get inundated with a lot of medical advice and also a lot of medical information. And
Yes.
somebody who likes to kind of dig and research everything, because I that's just my personality. I've read up a lot of things as well.
Sure.
So
Sure.
whenever somebody takes any supplements, always first take advice of your doctor. And the reason I say that is because a heart patient who might be borderline high in potassium ends up going taking
Exactly.
on extra potassium from the multivitamin, thinking that it
Exactly.
was going to benefit them, but that could actually potentially harm them.
Yes.
So
Yes.
while
Valid.
overall in itself the multivitamin is not going to hurt, but every circumstance is different. Every person's body situation is different. That's why I said one size doesn't fit all. Everyone has to look at their own circumstances, be aware, be fully aware what's
Absolutely.
going on with them, their body, and then
Yeah.
make a call for what fits them.
Yes. Very
That is
well
why
said.
I interjected. Sorry.
No, no, that's fine.
Varun ji, I just want to give one information. What actually happened today is, in one of the cases, a particular patient was admitted because he had fever since past 7 days. So he was admitted by his brother in a hospital. The doctor staff did not do his COVID test, and they took him with the presumption that this person is already COVID positive, and they gave him a double vial of remdesivir,
Okay.
and that person died within 1 hour. And now the brother is blaming the hospital authorities that these people, on what basis they declared him COVID positive without doing his test. So even such kind of incidents are happening nowadays.
Right. Right. And I'm just gonna take a minute here. So this is the video, Dr. K, that Sachin was referring to. Let me just play this.
एवरीवन, मैं डॉक्टर आलोक। मैं ये बिल्कुल भी नहीं देख पा रहा हूँ कि लोग ऑक्सीजन सिलेंडर के लिए भाग रहे हैं, कुछ भी देने के लिए, कितना भी अमाउंट देने के लिए रेडी हैं। ऐसा बिल्कुल मत करिए, ये मैं बिल्कुल भी नहीं देख पा रहा। मैं एक ट्रिक आपको बता रहा हूँ, ये आजमाइए और देखिए इससे कितना फायदा होगा। ये हमारी नेबुलाइजेशन मशीन है, ये नेबुलाइजर है, इसको हम ऐसे कनेक्ट करते हैं। इसमें हम नेबुलाइजेशन ड्रिप डालते हैं, ड्यूलिन एंड ड्यूडिकॉट। कुछ डालने की जरूरत नहीं है, कोई भी डालने की जरूरत नहीं है। इसको ऐसे कनेक्ट करिए, इसको यूं कनेक्ट करके ऐसे पीछे से ये कनेक्ट कर दीजिए। अपने फेस में इसको ऐसे करके यूं लगाना है, ऐसे लगाना है। इसमें कोई भी मेडिसिन डालने की जरूरत नहीं है। और एक काम करिए, इसको ऑन कर दीजिए, बैठ जाइए, बस ऐसे करना है आपको, ऐसे लगा के रखना है। हमारे एनवायरनमेंट में इतनी ऑक्सीजन है कि हमें इससे ऑक्सीजन मिल जाए। कोई भी लोग ऑक्सीजन सिलेंडर के पीछे मत भागिए, अपनी लाइफ को खतरे में मत डालिए। घर में बैठिए, एम्प्टी, सबके पास नेबुलाइजेशन मशीन है, लगाइए। मैंने इसमें कुछ भी नहीं डाला, ऐसे लगाइए, यूं लगाइए, बस। फ्री एयर में इतनी ऑक्सीजन है जितनी आपको जरूरत है। थैंक यू।
Okay.
Okay,
Any-
so I've just watched it. Thank you for showing me that video. I think that gentleman who is a doctor is saying whatever oxygen is in the air, you're going to get through that. I don't think he's saying it is concentrated, but I don't understand his logic of don't go for an oxygen cylinder, because if you remember when I mentioned earlier, the percentage of oxygen in normal air is 21%, whereas people who are needing this extra oxygen, they will need a higher percentage. So like 30%, 35, 40, you have 60, 70, there is a graded way how you give extra oxygen. So that depends on your clinical condition. So I think he's right in saying you're going to get the same oxygen that is in the air, which is 21%, but that is not equal to oxygen. You are getting supplementation of oxygen. Somebody whose lungs are destroyed, who are not able to absorb oxygen, they will need this help with this extra oxygen, because the lungs are predominantly affected by this virus. So they are destroying the lungs. So the lungs are not able to do the job they are supposed to do. That's why giving that extra oxygen is helping. And for people with extra oxygen still not helping, they're putting a tube down to help with their breathing. But that's much less than compared to the first wave, what happened here in our country here. So though he's right in saying you're getting the right or the same amount of oxygen, but if people need oxygen, they will need oxygen, and that will tell you from your oxygen saturations on your probe. So based on the local policy there, the doctors will advise you. So please seek consultation. It's not completely right that you don't need oxygen cylinder. I think he's mistaken to imagine that way. I don't know what his experience is, what his background is.
Right.
I will not say that you won't need oxygen. You're getting 21% irrespective of the nebulizer or not, because I didn't see it was connected to any oxygen. Like I said, it is driven by either oxygen or air. I think this is air driven one. And he's also saying you're getting the same oxygen in the air, which is 21%. But people getting affected by coronavirus, they need higher concentration, up to 100%. But 100% cannot be given just like that. There are ways of how it is given. So extra oxygen is also not good for us in general. So we will leave it for the doctors to decide on that. I'm glad you didn't share that video, Sachinji, and thank you for sharing that with me.
All right.
And thank you, Vinita ji, for sharing
Thank you.
your
Thank
experience
you.
and
Thank
showing
you.
us how important it is, why we need to stop this spread, because we have to save people like yourself, myself, who are all clinically vulnerable, and you can do that. Everyone can do
Yes.
that. Yes.
Sure.
Yes.
All right. On that
Thank
note,
you.
I'm gonna Vinita, again one more time. You continue to inspire. So please keep that
No.
motivation and keep on motivating us as well. And be strong, and everything will be not for you, but for everyone. It will be great. It will be back to normal. The regular days will be back.
Yes.
Like the
Look
data I
forward to that.
shared.
Yeah.
Let's look at
You
the brighter side.
Varun, एक है, see, life always will move on, whether we are ready for it or not.
Yeah, yeah.
So we either get on board, yeah, it's sink or swim. That's the only choice here. So,
Exactly.
and no matter how much we debate, ki, no matter what, we say ki, take this or take that, या इसने ये किया, हल्दी का पानी पिया, great, do it. But, it's like it will not replace a proper, well thought out treatment protocol
Absolutely. Absolutely.
is all I have to say.
All right. And,
All
and
right.
again, for that, I also thank Dr. K for doing this because doing such sessions, I think spreading more information and knowledge around certain things is important. So we'll continue to do that as many times as we want. And thank you for doing this, Doctor.
Yeah, and Sachin, I just want to say one thing to you about the incident you mentioned on certain, wrong assumptions. Look, the medical community, can you imagine being in their shoes today? For 1 second, can you imagine being in their shoes where thousands of people swarming at them, कोई गाली दे रहा है, कोई बेग कर रहा है उनके सामने आके कि हमको बचा दो, बस हमको बचा दो. These people are working under immense duress, stress, and they are responsible for somebody's life. Yeah, Dr. K, you know what I'm talking about. That responsibility comes with a lot of,
Yes.
personal, stress. And हमारे हाथ से, मेरे जॉब में मेरे हाथ से एक गलती हो गई तो सबसे ज्यादा क्या होगा कि चलो मुझे जॉब से निकाल दिया जाएगा, बट किसी की जान नहीं जाएगी. इनके हाथ से गलती होती है, किसी की जान जाती है. Nobody deliberately wants to hurt anyone. I believe that. No doctor wants to deliberately ever hurt their patients.
Yeah,
But
no, no,
it's,
I was
they are
just sharing
human.
a news that I saw. I was just sharing the
So
news.
Sachin, the only thing I want to say is वो news जब आप share करते हो तो let's give it some context. Number one, एक line बोल दिया उसका दूसरा, how does it help people? A message that is
No,
telling you
the
be
message,
aware. ऐसा भी हो
no,
सकता.
madam, the message here is that the doctors did not conduct COVID test on that patient.
Right, because
They admitted
then
him without
certain
doing a
time.
COVID test, and they gave him.
Sometimes that is the only way, because उसके अगर वो बंदा, what is the choice, अगर वो वहाँ पे सांस नहीं ले पा रहा है, and this is what is currently going on, टेस्ट कभी होगा पता नहीं, शायद 2 दिन लग जाए, वो पेशेंट अगर मर गया तो भी डॉक्टर के ही पीछे आएंगे ना लोग कि you didn't do anything to help him. It's a very difficult situation to be in. There's no right answer, wrong answer here.
No, madam,
So
but आजकल
without
हर
understanding the overall
आजकल किसी भी
context of
पेशेंट
that situation,
आजकल कोई भी पेशेंट जाता
कोई
है
भी
तो
person हो.
उसका पहले कोविड टेस्ट करते हैं, उसके बाद
हाँ, और
वो
कितने
दूसरा
लोगों
कोई
का ऐसे
ट्रीटमेंट
हुआ है
करते हैं.
कि कोविड
बट यहाँ
नेगेटिव
पे
निकला
एक
टेस्ट,
आदमी
लेकिन फिर भी उनका कुछ ना कुछ था प्रॉब्लम, देयर चेस्ट एक्सरे, देयर सिटी
दे
स्कैन
हैड टू
शोड
फॉलो
समथिंग.
मिनिमम प्रोटोकॉल तो फॉलो करना था.
I'm so sorry. I'm interrupting both of you guys. I'm really sorry, but I want to say something here. Like you pointed out, Vinita ji, the doctors are under a lot of stress and doctors can make mistakes. And what
Yeah.
happened with the guy Sachin ji has mentioned about, it is not correct. It shouldn't have happened. Okay. But it happened. So
Yeah.
we have to learn our lessons from that. So that is the reason.
Agreed.
Yeah.
Agreed.
So why they have given remdesivir on this gentleman? It is the person who's given who's supposed to justify it. We will not talk about it. But
Yeah, and that's what I was trying to get at. We don't know the
yes, I
context. We
understand.
don't know the situation that the
Yes.
doctor was
So
in. So
yes,
whether it was a right or wrong decision, we are nobody to judge it, is all I'm trying. I'm not defending the doctor, but
no,
I'm
no.
simply saying that like एक news article पढ़ के देना without the context, without knowing the full backstory of it, is also propagating some kind of negativity in the system that doesn't help.
True.
Is all I'm trying to
But
say.
equally, it has to be questioned. So it
Yes,
was.
and by
It
the
was
right
good.
authorities, right? There
Absolutely,
has to be a
absolutely.
review. There has to be understanding of why that decision was taken, and that if the doctor was negligent, and he has to be penalized for it. No doubt
Absolutely.
about it. But we
Can I just
reading a
add?
newspaper article cannot determine
Can I
that. Is
please
all I'm
add?
trying to say.
Can I
Yeah.
please add? Every medication comes with its own benefits and risks, be it
Yes.
be it
Yes.
remdesivir, anything else. So even if they are positive
Yes.
and they were given, they may still die. So there is that risk. So the people who are involved are the right people to answer what happened. So let's not get there. But it's a very vital thing that we are hearing about these things to be aware that don't push your doctors, don't stress your doctors, because they are doing a very difficult job there. They have to think straight. They have to do those decisions which are correct. And understandably, we are all anxious if a relative is not well. So we may be bombarding them with questions, but please try and understand they're looking after other people as well. I watched a video in Mumbai. I think they were speaking in Marathi yesterday, where somebody did something. Anyway, so it's important. So one thing doesn't work for everybody. One treatment doesn't work for everybody. So it is an independent, individual, customized management that has to be done, and it can be done only by a recognized physician who is authorized to do that. So very sad about this news, to hear about this news, but please be careful and don't push for things which are not reasonable for us, like having that injection. Yes, I think Ames was saying there is no evidence to say remdesivir was curing people. I think it was reducing the length of stay or something. I am sorry, I don't know much more than that. But yes, like I said, I don't want to get into the treatment part of it and stuff. But please trust your physicians and ask them questions. Certainly ask them questions. I'm not going to say be blind. Ask them questions, but ask them in the right way of asking questions, and be safe. Be sound and stay safe. I think what I say, keep saying, stay safe, be safe, and stay blessed. Everyone, my prayers, and stay positive, stay optimistic. We will get through this. Don't get disappointed or disheartened if those numbers are going up, like we've seen in those pictures. That is going to go up. Let's not put a number to that, how much, but there is an expectation they will go up. We also talked about the elements XYZ that could be in addition. So important thing for us from this session, if I can give one takeaway message, please follow those rules. Don't go out if you don't need to go out. Please wear a mask. Please wash your hands before and after you wear a mask. Maintain the social distance. If you're symptomatic, please isolate yourself. Get yourself tested. If you can't get yourself tested, still isolate yourself. If you get tested and you're negative and you're still having symptoms, continue to isolate yourself. Take the advice of your physicians as to what is the next best thing to do. Panic doesn't help your family as well. So if there is a room you can put yourself in and they can give you food and stuff, try and do that. Use all those precautions like wiping off those doorknobs and stuff so that it's not spreading. And if it is confirmed, then obviously you have to quarantine yourself for 14 days. That's my understanding. Please follow the local advice applicable to where you are, and you will become better. 80% of the population are getting better. That is the positive news I want you to take away from this message. If anything, is 80% of the people are going to get better. 20% may have some complications, and 5.5% of these people may succumb from what we get from the worldwide information. So it's really important to cut down those infections so that we can prevent this infection happening or spreading to people who are vulnerable, and thus reduce the loss of life. So please save lives. Be a hero in this war. You are a hero if you can follow these rules. So that's my simple and humble request.
Thank you, Doc. Thank you so much.
Thank
and
you.
Thanks everyone for joining. We'll continue to do that. And I will continue speaking and getting more people around this issue. Thank you so much. Take care.
Thank you.
And
Thank
have
you,
a great
Dr.
day.
K. And thank you, Sachin.
You're
All right.
welcome. Take care, everyone.
Thank you.
Bye.
Be safe.
Bye-bye.
Be safe. Bye now.
Bye now. All right. So just before I end the session, one last thing. Tomorrow, we are going to get Gaurav Arya, Major Gaurav Arya. Sorry about that. Somebody who you all have been waiting to see, meet, talk. Someone else would also be sharing, screen with me, and I'm still getting more information as and when I get the information. But one thing for sure, it is going to be Gaurav Arya tomorrow. So please stay tuned, and I'm just going to leave you guys with this message. So take care, stay safe, use all the precautions, and please pray for all the people who are either in the hospital right now or suffering, and also for the souls that we've lost. On that note, thank you, good night, and I will see you guys tomorrow.